How to use health insurance advice for expats properly. Beginner mistakes that cost you. Navigating health insurance as an expat can feel like a maze, and most beginners make mistakes that cost them thousands or leave them underinsured. You won't believe how simple oversights can create major problems. The first mistake is ignoring local requirements. Each country has different rules for residency, mandatory coverage, and minimum benefits. Failing to comply can result in fines or denial of care. Always verify regulations before selecting a plan. Another common error is assuming domestic policies will cover international care. Most US plans, for example, won't pay for treatment abroad. Expats need international or local health insurance with adequate emergency coverage. Many users also overlook network restrictions. Even global plans often require you to use certain hospitals or doctors. Check provider lists carefully to avoid surprise bills. A surprising mistake is underestimating out-of-pocket costs. Deductibles, co-pays, and currency conversion can add up quickly. Compare total potential expenses, not just premiums. Finally, beginners often neglect supplemental benefits like evacuation coverage, telemedicine, or wellness programs. These can save money and provide peace of mind in emergencies. To properly use health insurance advice for expats, research local rules, verify international coverage, confirm provider networks, calculate out-of-pocket costs, and leverage additional benefits. Avoiding these mistakes ensures your health is protected and you won't face unexpected financial shocks while living abroad.